There are few things more alarming during a pregnancy than unexpected bleeding, especially in the later stages. So today, we're going to break this down. What does it actually mean? What are the most common causes? And most importantly, why is getting medical help right away so critical? All right, so here's our game plan. We'll kick things off by defining what this warning sign is all about. Then we'll get into the two main culprits, what we're calling a painful separation and a blocked exit. After that, we'll put them head to head, see how the pros handle it in an emergency, and wrap it all up with the one thing you absolutely need to remember. And you might be thinking this is super rare, but it's really not. We're talking about something that complicates roughly 3 to 5% of all pregnancies. That's a pretty significant number, and it's why it's such a major focus in obstetrics. Okay, so the official medical term for this is antepartum hemorrhage, or APH for short. Now, the key thing to lock in here is the timing. This term specifically applies to any bleeding that happens after 20 weeks of pregnancy. That's the cutoff. All right, let's jump into our first major cause. We've nicknamed it painful separation, and it's our way of talking about a really serious condition known as placental abruption. Listen to this. This quote comes from a real clinical scenario, and it just perfectly paints the picture of a classic case. Notice the key words here. It starts suddenly. There's this persistent pain in the lower abdomen, and the bleeding is described as a dark fluid. Those are the big clues. So what is a placental abruption? Well, clinically, it's pretty much what it sounds like. Imagine the placenta is like a sticker on the inside of the uterine wall. An abruption is when that sticker starts to peel off too early, before the baby's delivered. And that is a really dangerous situation. It's the baby's lifeline, right? So this can cut off oxygen and nutrients, and at the same time cause major bleeding for the mother. So you're probably wondering, what makes this more likely to happen? Well, here are some of the main risk factors. High blood pressure, hypertension, and that includes preeclampsia, is a huge one. Then there's physical trauma to the abdomen, think something like a car accident. And yeah, certain lifestyle choices like smoking or cocaine use also play a significant role. Okay, but here's a twist. This is where things can get really tricky. What happens if this whole abruption thing is going on, but there's not much visible bleeding? Or maybe not at all? It's a super important question, because what you see on the outside doesn't always tell the whole story. And the answer is, the bleeding can be hidden. It's called a concealed abruption. Basically, the blood gets trapped behind the placenta inside the uterus. So you could have a really severe separation and a lot of internal bleeding, but only see a tiny trickle on the outside. This is exactly why that constant abdominal pain and a uterus that feels hard or rigid are such massive red flags. Okay, moving on to our second major cause. We're calling this one the blocked exit, and it's all about understanding a condition called placenta previa. And right away, listen to how different this patient's story is. The bleeding started just like before, but notice what's missing? No abdominal pain. And that right there, that single detail, is the classic sign that points doctors in a totally different direction. So with placenta previa, the issue isn't that the placenta is peeling away. It's all about location, location, location. The placenta has implanted way too low in the uterus, and it's blocking the exit. It's right over the cervix. Think of it like a roadblock. And in this case, the bleeding is coming from the mother's blood supply, which makes it a huge risk to her. So what are the risk factors for this one? Well, having had a C-section before is a big one. Also carrying twins or other multiples, using assisted conception like IVF, or just having a known issue with the shape of the uterus. All of those can increase the odds. Okay, so we've met our two main players. Now let's put them side by side. This is where we really nail down the key differences between abruption and previa. This chart really says it all. Abruption? Think painful bleeding and a rock-hard abdomen. Previa? Think painless bleeding and a soft belly. Honestly, if you remember one thing, it's this. That difference between pain and no pain is the #1 clue for doctors when they're figuring out what's going on. Okay, picture this. Someone arrives at the hospital with bleeding. What happens next? How do the medical teams spring into action? Let's walk through the standard emergency response for APH. First things first, every second counts. The team's immediate goals are to stabilize and assess. That means getting IVs in right away for fluids or blood. At the exact same time, they're hooking up monitors to keep a constant watch on the baby's heart rate. They're also figuring out exactly how much blood has been lost and getting blood ready for a transfusion, just in case. Oh, and if the baby is less than 36 weeks, they'll usually give a shot of corticosteroids to help those little lungs mature fast. From that point, it's like a fork in the road. Path 1, if the patient is unstable, we're talking heavy bleeding, signs of shock, the goal is simple. resuscitate and deliver that baby, like right now. Usually that means an emergency C-section. Path 2, if the patient is stable, then the decision really hinges on how the baby is doing. If the baby's in any distress, it's still off to the operating room. But if both mom and baby are stable, the team might just watch and wait. It's a strategy called expectant management, and it's all about buying a little more time for the baby to develop. Now, before we wrap up, I have to mention one more thing. It's a much rarer cause, but it is incredibly serious. It's called vasa previa. And this is when the baby's own blood vessels are exposed and running right across the exit. If those vessels tear, the baby can lose a catastrophic amount of blood very, very quickly. It is an absolute top-tier emergency.
Okay, that was a lot of information, I know. So let's boil it all down to the one critical takeaway. If you forget everything else, remember this.
Here it is. Any bleeding at all in the second half of a pregnancy is a medical emergency. Full stop. This is not a wait-and-see situation. It means you need to get evaluated by a doctor immediately to make sure both mom and baby are safe.
So I want to leave you with this final thought. Now that you know the difference, think about this. How does understanding the distinction between painful and painless bleeding do more than just help doctors? How does it empower a patient to walk into that emergency room and describe their symptoms with clarity and confidence right when it matters most?